Our project title is Heart Disease Prediction using Novel Ensemble and then Bleeding based on the Cardiovascular Disease Detection Network, Ensemble-Net and then BlCVDD-Net. Our project abstract is Cardiovascular Disease (PCD) remain to the leading cases of the mortality and timely and then accurate diagnosis. These studies are proposed to the two deep learning model. One is the EnsCVDD-Net and then another is a BlCVDD-Net designed to the predict CVD by the incorporate patient's health and then social economics factor will addressing data imbalancing using adaptive synthetic sampling. So Ensemble LU-Net and then RU model where to that blood to that RCU and then multilayer perceptron architecture. Feature selection is performed using to the point correlation coefficient method and model interpretively enhanced to the shape. Experimental result to demonstrated to that model achieving to the supervisor performance with 91% of the accuracy and then F1 score we get the 96 precision, 86 recall, outperforming outline and then state of art model. Ensemble BlCVDD-Net and also to drives to the comparative result with 88% of accuracy and F1 score. Both model are validated through the 10-fold across validation, offering to the robust, effective, efficient and then example tools for the yearly BCD detection and then improve clinical decision making. Our project flowchart is first we have start with the Anaconda Navigator spider tool and move on to the data selection. That is a heart disease data set we have taken after applying to the pre-processing. Data pre-processing considering to the three method. One is a missing values, another is a label encoding, another one is a normalization part. So 3 is completed means we can move on to the feature selection part and then data splitting process. The 80% of training and 20% of testing. After that we are applying to the classification algorithm, the both machine learning and deep learning algorithm wise. Finally we have predict to the heart disease will be occur and metric analysis. Finally we have into the process based on the flask application wise we have predict to that the heart disease will be occur or not. We have checked it on our project execution. First we have read to the data set, that is a data selection. So first we have read to the data, totally 11 category we have enter is age, sex, chest pain and then resting BP pressure, cholesterol, fasting VS and then resting ECG, max HR, heart rate and then exercise based and old peak and then ST scope. After to the heart disease will be occur or not. So these are the category for the pre-processing model. We can move on to the pre-processing step. After to that we can apply to the algorithm model. So these are the EDA plot. So next we can move on to that classification for the prediction part. So this is a home page. So first we have register. So can refresh to the page part. So register to the part. So username we have entered to the CMP and password as a CMP, role as a patient. We can register. So register is successfully means we can enter to the password. So after that we have welcome to that healthcare monitoring data. So we have entered to that details. So what are the details we have entered it, and cholesterol level, heart rate, everything we have entered. After to the predictor, that is a no heart disease will be occur. For example we have entered to the another details, the user enter will be there. And cholesterol level is a 120 and the heart rate is below that 65. We have predicted that is a heart disease will be occur. So we have check it on to the information. It's showing to that history wise. Next one, so this one we have log out. Next one we can register to that CMP1 and password as a CMP. So role as a doctor. So it's a confirm that, we can log in. So what are the patients we are checked it on, so that history will be showing that the report wise. So thank you.